बोला फोन कनेक्टर वाला नहीं रखने वाला था। Hello. Hi, good evening everyone. So post Diwali, uh, let us start with this session. And this is a session for basically the FMG students who are just about to give the exam. So many of you are tensed about what are the important topics, what are the must know topics. Sir, shall we revise those topics quickly? So yes, we shall be revising. Yeah. So DS, I'm trying to make it as interesting as possible for you people, and I'm trying to I'll try to discuss all the important topics that we can. So let us quickly start with this. Let us start with this. Okay, okay. So the first important topic that we will be revising is the burn. And you know, burn is very important topic for all the exams, and especially for FMG. Last few sessions we have been seeing a lot of questions on the topic of burn. So what are they? Remember, we have percentage based classification of burns. Now, when you talk about percentage based classification, what are the types of burn? We have mild, we have moderate, and we have severe. So we have mild, moderate, and we have severe category of burn. So mild, moderate, and severe. When you talk about mild, moderate, severe, how do we define? We define it in terms of PTB, that is partial thickness burn. So we have partial thickness burn, and then we have full thickness burn. Now, when you talk about partial thickness burn and full thickness burn, let us try to understand how do we use it. Let us see that. So partial thickness burn for kids, it's different, and partial thickness burn for adults, it's different. How do we see it? For kids, it is defined as less than 10% is mild, 10 to 20% is moderate, and more than 20% is what is severe. When you talk about adults, the same value goes to 15%. So 15%, less than 15% is voice is the voice clear now? Is the voice clear? Am I audible to everyone? Yeah, is the audio clear? So less than 15% is mild, 15 to 25% is moderate, and more than 25% it is severe. Then we have something like full thickness burn. When we talk about full thickness burn, the things are different. Yeah, it's a bit low. I think the audio settings. Just a minute. Just give me a minute. So when we talk about full thickness burn, irrespective of whether it is occurring in adults or whether it is occurring in kids, it is fixed. That is, less than 2% is mild, 2 to 10% is moderate, and more than 10% is what is that severe category burn. Apart from this, what are the others that we include in this? They are again very, 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 very important. The sunburn, the sunburn is what is included in mild. Remember, burns other than face and perineum. So the next thing is burns anywhere in the body other than face and perineum. So they are again very important. That face and perineum, they are not included in mild or moderate. Why? Because face and perineum goes into what? The category of the severe category of burns. So face and perineum, and then all the special burns. When we talk about special burns, what do you mean by special burn, students? It includes the electric burn, it includes the, you can say, chemical burns. So electric burn, chemical burn, yeah, all those things like inhalational burns, they're all included under this. So all the special category burns, they're included under the severe burns. Now, when you talk about the management, it is again very, 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 very important for you to understand the management. Now, what is the management? It is very, very simple. Answer is that mild category burns, they are managed in OPD. This is what is very, very, very important. You don't need to admit these patients. However, the moderate category patients and severe category patients, so moderate and severe burn patients, they require what? Hospital admission. Now you will say, sir, why are you teaching me this? Students, because you have got a lot of questions on one aspect, that what is the criteria for referral to burn care unit. Now the question has been twisted. Like whenever you admit a patient of burn, you admit the patient in burn care unit only. So you can say that moderate burn, that is a full thickness burn more than 10%, or students, any burn, full thickness burn more than 2%, or partial thickness burn more than 10% in kids, more than 15% in adults, or any special burn or burn involving the perineum and the face. This is what is very important. Now, one more category of patient require hospital admission, and that is what is the burn over face and the burn over palm. Sorry. So the burn over palm, or you can say hand, or you can say foot. Now, why is this so? Now, do you know that burn over the hand, if you talk about the percentage distribution, it is not much. It may be as much as 2.5%. So do you know what is the problem with this burn? The problem with this burn is that whenever there is burn, there is inflammation. And since there is increased inflammation, this inflammation will lead to what? Exudation. Yeah, very good, Tinu. It is 1% is that palmar surface. This is the palmar surface. And complete hand with wrist, this is 2.5%. So when there is increased inflammation, there is exudation. And do you know that this hand is an inelastic component, you can say compartment. So there is increased compartmental pressure. And once there is increased compartmental pressure, students, what is going to happen now? This is going to lead to what? Compartment syndrome. So this is going to lead to ischemia, and you know ischemia is going to lead to what? Necrosis, and you can say necrosis can lead to what? Gangrene ultimately. And this is what is better defined as compartment syndrome. Now students, in last 4-5 years, we've got two kinds of question. Very good, very good, very good. What is the first series of question? The features of compartment syndrome. The features of compartment syndrome, they start at what pressure, and what is the classical first line clinical sign? Come on students. What is the most reliable clinical sign? Most reliable clinical sign. Answer is pain on passive extension. So students, pain on passive extension, this is what is very, 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 very important. The second is the features of compartment syndrome. They start at what pressure? They start at pressure more than 30 mmHg, as one of our student has already answered. The second is the gangrene or the necrosis. So the gangrene happens at what pressure? Come on. Everyone is saying volume is too low, volume is too low. I don't know. I don't understand. Just a minute. Just a minute. Okay. Try to refresh, but according to me, from my side, it is absolutely fine. So gangrene occurs at a pressure. Gangrene occurs at a pressure more than 45 mm Hg. And students, this is what is again very, 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 very important. So remember, the features start at 30 mm Hg and gangrene happens at 45 mm Hg. Now, what is the treatment for this? Come on, tell me. What is the management for this? Answer is fasciotomy. What do you mean by fasciotomy? The main aim of fasciotomy is to open up the compartment and release the pressure so that ischemic necrosis can be avoided. The next is, let us talk about simply, since this is, I need to revise a lot of things for the FMGE exams. So I'll not go into everything in detail and depth. Let us try to understand quickly some things from the special burns. Now, when we talk about special burns, I'm not going to discuss the complete chapter, students. One or two important topics from every hand-picked topics. And what I feel that electric burn is what is very, very, very important for you. So when you talk about electric burn, what is so significant of electric burn? Electric burn is always a full thickness burn. So try to understand it is always a full thickness burn. Now when you talk about electric burn, the next thing is to assess the damage. So the maximum damage happens to what? And the minimum damage or least damage happens to what? So maximum and minimum damage. Now let us try to understand that maximum damage happens to one very important structure, that is blood. And what else, students? Soft connective tissue. Soft connective tissue. So when we talk about soft connective tissue, we have blood in this, then we have what? Muscle in this. So blood, muscles, they are the one which are massively impacted. Collagen, yeah. Now when you talk about minimum, tell me the most resistant structure. It is skin more than what, students? Bone. So skin more than bone. Now one very important thing that you need to understand, as there is damage to blood. Now what will happen if there is damage to blood? So since there is damage to blood, there is increase in anaerobic respiration. And since there is increase in anaerobic respiration, students, what is going to happen now because of increased anaerobic respiration? Come on, tell me. There is increase clostridial infections. And since there is increased clostridial infections, you get to see the patients of gas, gangrene. So gas, gangrene is very, very, very evident in them. The second thing is, do you know that the most common long-term complication of electric burn? So the most common long-term complication of electric burn, yeah, answer is cataract. Why there is cataract? The answer is very, very, very simple, due to damage to ocular collagen. The third thing that we need to understand is, whenever we are talking about this, you can say damage, there is one more structure which is also damaged, that is muscle. And because of this muscle, we have a lot of things like myoglobinuria, we shall be discussing. One more important thing is that, do you know that bone is very resistant structure? Everyone is understanding that bone is resistant. But then what about the bone as a complete complex? You know, bone has that bone marrow, that is a soft connective tissue. And marrow is destroyed. And that is why you have brittle bones. So why do you see that pathological fractures? Because of the destruction of the bone marrow. Because of the destruction of the bone marrow, you have brittle bones, and therefore there is increased risk of what, students? Pathological fractures. And this is again very, very, very important. Now let us try to understand the concept of electric burn. And this is again very, 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 very important, very important. So when you talk about the concept of electric burn, let us try to summarize all the things that we have till now tried to discuss. The first thing is, there will be breakdown of RBCs. Now since there is breakdown of RBC, What will be released? There will be excessive release of K plus. So there is massive release of K plus. So massive K plus release. And do you know this massive K plus release is going to cause the stimulation to heart? And then tararara and tararam pum pum. So ventricular arrhythmias. Yeah. So ventricular arrhythmias is what is a big problem. So ventricular fibrillation basically. Ventricular fibrillation. This is the most common cause of mortality or death. The next thing that you need to understand, since there is breakdown of, you can say, RBC, what is the next thing that is going to develop? There will be anaerobic respiration. And since there is anaerobic respiration, what will be the classical profile of the body? Therefore, there will be metabolic acidosis. Why there will be metabolic acidosis? Because of the increased accumulation of what? Lactate. Because simply there is increased accumulation of lactate. This is what is very important thing to understand. Meanwhile, you are seeing that there is breakdown of what, students? Muscle also. So there is catabolism of the muscle. Catabolism, once it starts, it is not going to just finish it off in 1 or 2 days. It takes maybe weeks or maybe months, or maybe in some cases it might go up to years also. So there is catabolism of the muscle, and therefore the first thing that you get to see is myoglobinuria. So there is myoglobinuria, one very important thing, and one thing is metabolic acidosis. Do you know that in order to overcome this acidosis, the kidneys, they excrete more and more of what? Acid from the body. Kidneys will have always a buffer action. So if it is a state of acidosis, there will be increased acid excretion from the body, so that you can buffer off the what? State of acidosis. Now, do you know this myoglobinuria? This is going to cause clogging of renal tubules, with myoglobin. And due to this acidic environment inside the kidney, do you know, whenever we talk about any damage, now nowadays there's a trend of drinking alkaline water. Why? We say that majority of the damages in the body occurs in the acidic environment. So on one hand, you have the renal tubules getting clogged with what? The myoglobin, and on the other hand, there is acid being excreted out from the kidney, and this is going to precipitate acute tubular necrosis, and this is what is very dangerous. Now try to understand, the catabolism has started. It will not stop in a day or two. It will take some time, and then only it will settle down. So catabolism will settle down at its own pace. But what about the body? So you cannot reduce the myoglobin load. However, you can actually alkalinize the urine. So therefore, alkalinization of urine is the treatment of choice for myoglobinuria. And this is what is very important. So alkaline diuresis is important. Second is, because of the catabolism of the muscle, there is loss of lean body weight. Now when we talk about loss of lean body weight, you get a lot of questions in this also. What is that? If there is 10% loss, so 10% loss, so on one side there will be loss, on one side there shall be effect. So due to 10% loss, there is increased risk of sepsis. Due to 20% loss, there is increased risk of impaired wound healing. Due to 30% loss, what will happen? There will be pneumonia, or you can say pressure sores. And due to 40%, what will happen, students? Death. So all these things are very important. When you talk about the management of electric burn, now this is again very important. The first thing that you need to understand is intensive cardiac monitoring. This is point number 1. The second priority is to correction of acidosis. Recently, we had a patient of electric burn. Why I'm teaching you this? That patient, we admitted that patient 7 days back. So the patient was a patient of electrocution, and patient came to us. Patient was absolutely normal, but we counseled that patient to get admitted. Patient said, no, no, we don't need to get admitted. Everything is fine. Doctor, you give us a discharge. And yesterday the patient came to hospital. Yesterday the patient came to hospital and the patient was gasping. Why? Because of this arrhythmia which has settled in. So don't take the things for granted. People think that doctors have a tendency to admit the patient, they want to generate the business. Okay, that may be a collateral effect, that money is generated because of these procedures and everything. But this is not the prime objective, students. What you will do of money if you cannot save the patient? If the patient is not there, if the person is not there, what you will do of money? So we can only guide them, but they will not understand. So try to understand this electric burn is a very serious thing. It's not a very simple issue. So intense cardiac monitoring, correction of acidosis, and along with that, the supportive care that you actually give to the patients. Let us see, let us quickly go to the treatment concept of burn. Treatment of burn or the management of burn. Management of burn, when we talk about, we need to understand two things in this. Good evening, Devraj. Hi, how are you? Yeah. So there are two things that we need to understand. First is calculation of burn surface area. This is one very important thing, because until and unless you don't have the TB assays, you cannot assess anything. And the second thing that you need to understand is the management in terms of fluids, management in terms of nutrition, and management in terms of what? Sepsis. So you need to understand that antimicrobial agents, nutrition, fluid, they are the three important pillars. And to understand them, you need to understand one very important thing, that what is the total burn surface area. Now you have a lot of formulas, but we don't use any of them. The standard formula that we use is Wallace rule. So Wallace rule is what we classically use. This is also known as rule of 9. Why it is the standard thing that is used? Because you can recall it anytime you want. Yeah. I just trained them during Diwali holidays. Okay. So rule of 9 is very, very, very important thing. Why it is important? Because you can recall it anytime. And burn is a serious affair. When a patient comes to the emergency and you start thinking that London border chart, it's so complex that you often tend to miss out a lot of things. So rule of 9, everyone knows. But the only thing that you need to understand is 9%. When you talk about adults, this is 9. And the legs are given what? 18% each. Yeah. When you transit from adult to a kid, yeah, to kids, what is that? The head takes 18% now, and then the lower limb, 18% it was each. So 4.5 is deducted. So 13.5% goes to the what? Lower limb, each limb. Now you will say, sir, how do we distribute this? In this, the buttock is given 2.5%, the thigh is given 5%, and the leg is given 6%. And this is what is very, 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 very important. Very important. Let us try to understand. Apart from this, you can use rule of palm. Now you will say, sir, why not London border chart? Bache, it is so good that we don't use it. It is used by forensic experts who have to file an autopsy report. हमें कुछ नहीं चाहिए होता है. We just require a brief overview. Now, when you talk about rule of palm, the palm with this extended finger, this much part, includes what? 1%. So this is useful, important. It is useful for calculation of mixed thickness burn, and this is what is very, 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 very important. Rule of palm. So we have adults, we have kids, and when we talk about infants, it is 20-20 rule. So what is that 20% rule? Try to understand. In adults, the head is 20%, this abdomen and thorax 20%, and then each upper extremity 10-10, so equal to 20%, and each lower extremity is also 10-10%, so 20%. So this is what is the rule of 9 or a Wallace rule, and students, you will use this rule only. The next is, let us talk about how do we calculate fluids. Since this is a concise revision class, so I will be selecting the topics and will be teaching you accordingly. So when you talk about fluids, there are two things. What is the choice of the fluid? When you talk about the choice of the fluid, there is no other option better than RL in this case. For less than 2 years, you need to add a source of what? Dextrose also. So 5% dextrose also is added. Now the next question is, what is the volume requirement calculation? So volume requirement calculation, we are now using what? ATLS modification. So ATLS modification of Parklands. What is that ATLS modification of Parklands? For that, you need to understand what is the standard Parklands formula. When you talk about the Parklands formula, students, the Parklands formula was 4 ml per kg per BSA. This was the Parklands formula, which used to give you VML per day. Out of this, you used to divide this V into V by 2, which was to be given in first 8 hours, and the remaining V by 2, is to be given in next 16 hours. This was the rule. The next is, now what is the formula for adults? Instead of this 4, everything is with us, but this same formula has been modified to 2 ml per kg per BSA. For kids, it is 3 ml or kg per BSA. For electric burn, since the point of entry might be deceptive, why? Because skin is very resistant, so you might not get the exact amount. So for the electric burn patients, we still use the formula of 4 ml per kg per BSA. The important thing is, one very, very, very important thing is, if first 8 hours have elapsed, or students, if the time of burn is not known, are you getting? So what is the formula to be used? Yeah, anyone? Time of injury not known. In that case, one very important thing that you need to understand is, use the master formula. Now, what is this master formula? It is very, very simple. It is TBSA into body weight. TBSA into body weight divided by 8 is equal to VML per hour. This is about the fluids. Next is, what about the colloids? Colloids are avoided in first 12 to 24 hours. After that, you can give it at rate of 0.5 ml per kg per day. What about the nutrition? When you talk about the nutrition, it's very, very, very simple. The calorie requirement. So when you talk about the calorie requirement, it is defined as 25 kilocalorie per kg plus 40 kilocalorie per burn surface area. This is equal to kilocalorie per day. Now, in comparison to a normal patient who requires 30 kilocalorie per day, you're giving a lot more extra. Why? Because burn is a state of catabolism and you need to give some extra calories to fight. And the name of this formula is Curie's formula. This is Curie's formula. This is what is important. The next is, when you talk about the antimicrobial agents, what are the important things that you need to understand? They are very important to prevent sepsis. And we have topical and we have systemic. So which is preferred, students? Systemic or topical? Always remember that topical is what is preferred. And what are the standard agents? I've already taught this thing in detail and depth, that there are two types of pattern. One is soaks and one is salves. What is soaks? You put the dressing and you keep on pouring the antimicrobial agent every day. And the example is hyaluronic acid, Daikin solution, 1% acetic acid. And then what is salves? You put the dressing and you change it every day. So silver sulfadiazine, silver nitrate, sulfamylon, all those things are your salves. So remember the silver sulfadiazine. So 2% silver sulfadiazine. This is classically very important. Then we have silver nitrate. Then we have sulfamylon. Yeah. That is mephenide acetate. Mephenide acetate. They are again very, very, very important. Do you know what is beautiful property of silver? It is antimicrobial, it is antifungal also. One drawback of silver is that whenever you buy something of silver, we are always anxious that it will get, you can say, it will oxidize and take that blackish color. So you get that black pigmentation which is known as pseudoescar. One more drawback of silver is that it has a leaching effect. So leaching of sodium is important. Sulfamylon, it is anti-pseudomonal and anti-clostridial. Still, it is not that popular because it's very painful on application. So, students, this was a brief session on, you can say, burn. And every day for your exams, I would be getting more and more interesting topics, and we would be revising in under this series.